So good afternoon to all. So today again the pharmacology topic, that is the diuretics part 2. Diuretics part 2. So today I will discuss about the loop diuretics. Clear? That is the loop diuretics. Loop diuretics. So that the loop diuretics that acts on the thick ascending limb, that acts on the thick ascending limb. Clear? Thick ascending limb. The loop diuretics acts on the thick ascending limb. Clear? The loop diuretics acts on the thick ascending limb. So this is a one mark question in the entrance examination. Then what is the side effects? What is the side effects of loop diuretics? The side effects is the loop diuretics is side effects. Side effects. The first side effects is the hyponatremia. Is the hyponatremia. Second one is the dehydration. The hyponatremia, the dehydration, then hypotension, and the hypotension. Clear? The first side is the hyponatremia, dehydration, then hypotension. Okay. That is the three side effect of loop diuretics. As the hyponatremia is the decrease sodium level, then the dehydration, then the hypotension. Then hypotension is the decreased blood pressure. That is the three side effect of loop diuretics. Three side effects of loop diuretics. Then, if the entrance examination, the question asked which diuretics is the most potent diuretics. The loop diuretic is the most potent diuretic. Clear? It is the question. The loop diuretic is the most potent diuretic. That is the question. Clear? The loop diuretics is the most potent diuretics. That is the question. Clear? The loop diuretics is the most potent diuretics. So the loop diuretics is used in the high hypertensive patient and pulmonary edema patient. Pulmonary edema patient. The loop diuretics used in first one is the hypertensive emergency. Hypertensive emergency means high BP, high blood pressure. In this case, we administer the loop diuretics. Then second one is the pulmonary edema. Pulmonary edema. Yeah. This is the most common case we use the loop diuretics. First one is the hypertensive emergency. Second one is the pulmonary edema. Then in the loop diuretics, the most fatal side effect in the loop diuretics, the most fatal side effect, most fatal side effect is first one is the hyperuricemia. Hyperuricemia means hyperuricemia means high uric acid. Clear? This is the high uric acid. Increase uric acid. Increase uric acid. So that it causes gout. Causes gout. Clear? The most fatal side effect of loop diabetes, first one is the hyperuricemia means high uric acid in blood. So that it causes the gout. Second one is the hyperglycemia. Second one is the hyperglycemia. Hyperglycemia means high blood sugar level. High blood sugar level. High blood sugar level. Clear? This is the most fatal side effect. Most fatal side effect of loop diuretics. That is the hyperuricemia means high uric acid in blood. Second one is the hyperglycemia. Then the loop diuretics drug are furosemide and the torsemide. Furosemide. Second one is the torsemide. Yeah. Furosemide means the Lasix. Yeah. The furosemide and the torsemide are two drugs are the loop diuretics, are called as the loop diuretics. Clear? Also it is working the loop of ascending loop of Henle. Ascending, thick ascending loop or also called as ascending loop of Henle. That is the furosemide means the Lasix and the torsemide. That is the two loop diuretics. So between two loop diuretics, furosemide and the torsemide are the longest acting. Longest acting. Clear? Between two loop diuretics, furosemide and the torsemide are the longest acting loop diuretics. Then we will move to the thiazide diuretics. Clear? Thiazide diuretics. Thiazides. Thiazide. First is the chlorothiazide. First is the chlorothiazide. Yeah. Thiazide diuretic. First one drug is the chlorothiazide. The chlorothiazide is the shortest acting. The shortest acting. Yeah. The chlorothiazide is the shortest acting. Yeah. Chlorothiazide is the shortest acting drug. That is the one. Then second one is the chlorothalidone D. That is the longest acting. That is the longest acting. Yeah, that is the chlorothalidone D. That is the longest acting. Chlorothalidone D. That is the longest acting thiazides. Then we will move to the K plus sparing diuretics. K plus means the potassium sparing diuretics. Then K plus sparing diuretics. K plus sparing diuretic. That is the K plus means the potassium sparing diuretics. That is the spironolactone. Clear? The K plus sparing diuretic is the spironolactone. Spironolactone is used in resistant edema. In the resistant edema or the long-term edema, we should use the spironolactone. The spironolactone is the K plus or the potassium sparing diuretics. So, what is the side effect of spironolactone? What is the side effects? Side effects. First one is the side effect of spironolactone. First one is the gynecomastia. Gynecomastia in males. Gynecomastia is males. Menstrual irregularities. Menstrual irregularities in females. Yeah. The side effect of spironolactone, first one is the gynecomastia in males, the menstrual irregularities in female. That is the most common side effect of spironolactone. Then the amiloride. Then another diuretics is the amiloride. Amiloride. The amiloride diuretics is used in the lithium-induced diabetes insipidus. Clear? The amiloride diuretics is used used in the lithium induced diabetes insipidus. Yeah, the amiloride is the diuretic. The amiloride is the diuretic used in the lithium-induced diabetes insipidus. What is diabetes insipidus? The diabetes insipidus occurs when the lack of vasopressin secreted in the pituitary gland. Clear? The lack of vasopressin secreted in the pituitary gland, so that the diabetes insipidus can occurs. That is the diabetes insipidus. Then another diuretics, that is the osmotic diuretics. Clear? Osmotic diuretics. The osmotic diuretics. Osmotic diuretics is most preferred in the cerebral edema and acute congestive glaucoma. Cerebral edema and second one acute congestive glaucoma. Clear? The osmotic diuretics is the used in the cerebral edema and the acute congestive glaucoma. Clear? What is the osmotic diuretic? The drug of choice of osmotic diuretics is the mannitol. Clear? The mannitol is the mannitol. The mannitol is the osmotic diuretics. The mannitol is the osmotic diuretics that also used in cerebral edema and acute congestive glaucoma. Acute congestive glaucoma. So the next class will discuss about the new pharmacology topic, that is the pharmacology part 3, that is the anti-diuretics. That is a small topic. So this is all about the diuretics. Clear? So thank you to all.